Welcome to the New York State COVID-19 pandemic response presentation. Despite thinking we had done everything right, from dashboards to lockdowns, New York State didn't act quickly enough, early enough. And we didn't factor in two important variables: the lack of trust by the public and the vaccine hesitancy among various groups within the population across New York State. Thus, we have made it our vision and mission to restore trust, overcome hesitancy, and increase vaccine adoption. Today, as we try to make up for lost time and trust, we present this proposal to the New York State Governor's Office, New York State Department of Public Health, New York State political leaders, and others of you who have the power to ensure this proposal and the recommendations within come to fruition. New York State specific data collected from March 1st, 2020 through March 1st, 2021 are shown here. During this time, deaths per 100,000 are higher in New York State than in the United States as a whole. New York State was hard hit. Achieving the highest vaccination rate possible as soon as possible is imperative. To achieve this, we must restore trust and overcome vaccine hesitancy. On March 10th of 2020, Governor Andrew Cuomo ordered the nation's first coronavirus containment zone in Westchester County's New Rochelle. Although state health officials gave clear guidance on what to do, they had acted too little too late. Actions were taken and many public health interventions were put in place. For example, we recruited retired and out-of-state doctors and nurses to help overwhelmed hospitals. We secured ventilators and PPE. We were the first state to obtain federal approval for our own coronavirus testing. Though it was slow and torturous, eventually testing capacity was expanded. There was public encouragement for all to work from home. Restrictions were placed on having large gatherings with reduced occupancy for restaurants and bars. A mask mandate was instituted. The governor gave daily press conferences for updates and changes in policies. The New York State contact tracing app was deployed. None of these touched on trust or hesitancy. Since that time, research has showed us that if state public health protocols and guidelines with social distancing had been mandated even a week earlier, more than 17,000 lives could have been saved statewide. The virus had already taken the lead, and from the public's view, the public health system did not have things under control. Pre-existing distrust of government, pharmaceutical companies, and public health officials grew. Let's turn this around. To do so, we recommend innovations in communication, community engagement, and improvements in operations. This proposal prioritizes the dissemination of information about vaccine development and safety coming from sources trusted by groups where vaccine hesitancy is highest. Thus, clinicians, religious leaders, and local organization leaders spread the word directly within their communities. The New York State vaccine appointment scheduling website itself and the technical problems with it further disincentivize people who already struggle with vaccine hesitancy. If you are less tech savvy, have limited resources, or face a language barrier, getting vaccinated begins to feel like an insurmountable challenge. New York State must remove these barriers. Our technical recommendations for solutions include the following. First, improve the New York State vaccine website. The site is full of bugs. People are frustrated by these vaccination challenges. Fixing these technology issues needs to be top priority. Second, use QR code technology to provide vaccine information and scheduling functionality that would be easily accessible in public spaces, such as clinics and at bus stops. Next, more thorough vaccine safety information needs to be made available on the main screens of the state website with instructional videos explaining the appointment booking process, which needs to be made available in multiple languages. Last, focus on overcoming community-specific barriers to vaccine hesitancy. The state needs to identify clinicians, communities, social service organizations who are trusted sources within vaccine hesitant groups and partner with those identified. For example, Republicans are more likely to trust their primary care physicians. Black Americans are more likely to trust Black physicians. Information coming from strategic partners rather than directly from New York State is known to be more effective in increasing vaccine adoption. Setting attainable targets to achieve in vaccine delivery and adoption is key to managing performance. Elements to set forth include daily, weekly, and monthly goals, objectives, and implementation strategies within each region of the state. Each region should have a minimum 95% administration rate so that little to no vaccine goes unused. In addition to vaccine supply and administration numbers, our strategies for qualitative feedback allow us to, number one, obtain information about which aspects of our response are effective and which can be improved. Two, identify if users have been successful in obtaining vaccine appointments or finding vaccine information. And three, determine if alternative safety measures are being utilized. Our process in supporting and leveraging strategic partnerships involves the identification of stakeholders' needs for support from the state, whether that be financial, material, technical, etc. With supports from the state, strategic partners' involvement can improve trust and effectively address the specific issues related to each group's hesitancy, leading to increased vaccinations. For example, the New York region of the National Medical Association and Black Physicians Network of Greater Rochester to reach Black community and local clinical providers. A partnership with the New York State Catholic Conference will be crucial to reaching the large number of Republicans who have high hesitancy and to manage criticisms and concerns voiced by the church. Communication between the state, partners, and the public is crucial to the success of this proposal. The state must establish a sustained, continuous feedback loop of communication with partners. There must be a regular cadence of touch points to provide partners with new information and updates, and to understand how strategies are working or not working. In addition, forums will be established where partners can come together to share best practices around addressing vaccine hesitancy with their constituents. Since partners are already engaged with their communities, existing lines of communication will be utilized to reach members of the public who are hesitant to get the vaccine. Partners will run vaccine information sessions and vaccine events. They will be given talking points on the benefits of the vaccine and the positive impact that getting vaccinated will have on their overall community. They will also be provided with a vaccine hesitancy toolkit containing clear and concise information about the vaccine and its safety. An integral aspect of accomplishing the vision and mission will be to improve pandemic data and information sharing across all New York State counties. This will ensure a coordinated response with strategic messaging to combat vaccine misinformation, provide status updates to the public, ensure resource sharing, facilitate logistical planning, and improve educational outreach. The New York State Catholic Conference may be an opponent on some issues related to the vision and mission. Securing a working relationship with them will be fundamental for effective implementation, given their large sphere of influence in New York State. Catholics represent the largest single religious faith in New York, numbering approximately 7.3 million out of a population of 19.3 million. The church is politically active and has already come out with moral concerns about the Johnson & Johnson vaccine. This is important because many Catholics follow the church's teaching in their voting and behavioral patterns. Going forward, a working relationship with this organization will help to avoid future derailment of vaccination efforts. Our vision of restoring trust in the public health system is lofty, but necessary overall. This proposal strengthens the health and safety of New York State. We ask for your consideration to ensure that public health stakeholders' expertise is properly utilized in our future and our current vaccination efforts. Thank you.